Hello, my name is Ben, and I will be demonstrating 3 skills important to emergency response. First, I will be demonstrating how to properly remove latex gloves. So first, you want to pinch the palm side of the glove and pull it towards your fingertips. Then, you want to place it in the palm of the still gloved hand, and then pinch the inside of the gloved hand. Make sure not to touch the outside, and bring that towards your fingertips. And that will bring the glove you placed in your palm inside the other glove, making sure you don't touch it. Then, once you're done with that, simply dispose. Next, I will be demonstrating how to check a responsive person in an emergency situation. So first, you want to make sure the scene is safe, and then go up to the person. And if they're responsive, you want to ask first, with an interview, to get a read on the situation and any injuries they might have. You first want to ask how they're feeling, if they can describe any symptoms to you, like nausea or an injury like a broken limb. And then you want to ask if they have any allergies and how severe the allergies are. And then next, you want to ask about their medical history, if they have any medical conditions which could be important for treating them. And then next, you want to ask if they've had anything to drink and how much when they last drank or ate. And then you want to ask about the events leading up to the emergency so that you can better assess. Alright, so next we are going to be doing a body check. If the person consents to it, you need to do a systematic body check from the head down to the toes. And so first, you're going to start at the head. If the person has any sort of spinal injury that you can see, refrain from moving the head at all, as it could cause further damage. So first, you're going to check for the scalp, the eyes, the nose, the ears, and the neck. And remember, don't move it if they have a spinal injury. Next, you're going to move onto the shoulders, move them around a little bit, see if they feel any discomfort. And then next, you're going to be going for the chest and the abdomen. Touch it a little bit. Ask them to take a deep breath and exhale. If it seems like they're having trouble breathing or have pain while breathing, then note that. Next, you're going to go for the arms, have them move them around a bit, and then have them wiggle their hands and their fingers. And do each arm one at a time. Have them do the same on each arm. The hands and fingers. All right. Next, you move down to the hips and ask them if they have any hip pain. And then you do each leg, have them extend, wiggle the feet and toes. Extend, wiggle the feet and toes. All right. So if any conditions are found, give proper care and call 911 and give proper care until medical assistance arrives. If the patient doesn't seem to have any sort of medical injury or illness, keep them in a comfortable position and check them every once in a while to make sure that their condition has not changed. In this portion, I will be showing you how to check an unresponsive person. So first, you arrive on the scene. You see the person is laid on the ground and they're not responding. You shout, "Hey, are you okay?" And if they do not respond, tap their shoulder, try to do anything to get them awake. If they don't respond to that, lower your ear to their mouth, check for breathing, check their carotid artery for a pulse for no more than 10 to 15 seconds. If they do not seem to be breathing normally, they're gasping, their breathing is interrupted, they're not breathing normally. Next, you want to call 911. Call 911, get an AED. And then if there are any other bystanders around, you use the questions from the previous portion to get more information. And while you're doing that, you want to carefully move them over into a recovery position. Make sure their arm is stretched out this way, and wait until help arrives. Additionally, if you are dealing with an unresponsive infant, to try to get their attention, you should tap them by the bottom of their foot. If the person is not responding and is not breathing normally, you want to call 911, get an AED, and then you want to immediately perform CPR. First, give 30 compressions, and then 2 breaths every cycle.